Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. Here are some of the highlights this hour. Nigeria acknowledges donations amounting to over 1.6 billion naira for the fight against COVID-19. Resident doctors make good their threat to embark on nationwide strike. And Egypt reopens airports after suspending regular commercial flights in March due to the coronavirus outbreak. Nigeria continues to record more COVID-19 cases as the Nigeria Center for Disease Control (NCDC) records a total of 16,085 confirmed cases in the country. Gombe State, for the first time, recorded the highest number of COVID-19 cases in the country, with 73 infections out of the 403 announced by the NCDC yesterday. A total of 5,220 patients have recovered, and the death toll is put at 420. Here's a breakdown by region showing Lagos State in the southwest with 7,103 cases. The FCT recorded no new case, but leads in the north central with 1,247. Cases in Kano, Kano's leading in the northwest with 1,137 cases. Edo leads in the south-south region with 580 cases. Borno still tops in the northeast with 438 cases, and Abia State displaced Ebonyi in the southeast to top that region with 166 cases. Nigeria has so far received over 1.6 billion naira donations in the fight against COVID-19. This revelation was contained in a public notice with details of the donations received through deposit money banks, DMBs, the Central Bank of Nigeria, Treasury Single Account, TSA, and signed by the Accountant General of the Federation, Mr. Ahmed Idris. According to him, the eradication of COVID-19 support donations were received through designated account from 1st of April to 31st May 2020. Recently, the federal government, through the Office of the Accountant General of the Federation, opened commercial bank accounts in addition to the CBN TSA account through which donations to support the eradication of COVID-19 in Nigeria could be made. This is to ensure the effective, efficient coordination and also the management of funds. The Presidential Task Force resumed its briefing today after the celebration of Democracy Day on June the 12th. The chairman of the committee and secretary to the government of the Federation, Mr. Boss Mustafa, warns that even though there is relaxation of the restriction order, it doesn't mean that life has returned to normal. He said that the government is concerned about the high levels of breaches on interstate travel.
Mr. President's concerns about the impact of COVID-19 is underscored by the fact that 15 paragraphs of his broadcast were dedicated to COVID-19 issues. This buttresses the fact that the virus is still very deadly and everyone must take cautious effort to stop the spread by adhering to the guidelines and measures prescribed by the Presidential Task Force. In the course of our monitoring and surveillance of compliance across the nation, we have observed an escalation of the level of non-compliance with simple measures to keep social distancing, wearing of masks in public places, sanitation and hygiene. This is more prevalent in markets, motor parks, and some places of worship. The breach of the ban on interstate travels is also a point of concern. Over the last couple of days, you must have observed that the daily figures of the confirmed cases have been on the rise. This is an indication that we are conducting more tests across the country and that we are fully in the community spread phase. We, however, urge Nigerians not to panic, but to cooperate with the public health officials, especially where community testing is ongoing.
For the Minister of Health, Dr. Osage Hanire, the government is doing all it can to ensure that it keeps its fatalities from COVID-19 low. And just like the SGF, he also says it is important to follow the advisories on COVID-19.
The case fatality rate remains at about 3%, which is lower than many countries, but not a cause for relief. The increasing pace of testing will yield more cases, but we need to also be proactive in keeping fatalities low, and this is not impossible. It is still strongly advised that those who test positive present themselves at a treatment center, and this is most especially so for those with underlying ailments like diabetes, hypertension, cancer, HIV, tuberculosis, or those who are 60 years old or above. These are the vulnerable population and form the majority of fatalities of COVID-19. In conversation with Lagos State authorities has reported that people who delay going to hospital and begin treating themselves at home are at risk, and they are the majority of the victims. And those who have had underlying ailments and delay are the ones who barely can make it to the doorstep of the hospital. Early registration for treatment for vulnerable population will save more lives.
In the meantime, the World Health Organization country director has been explaining the ongoing studies of asymptomatic patients. Ms. Fiona Bracker says the WHO still believes that asymptomatic persons can transmit COVID-19 as she appeals for more cooperation with the World Health Body in its efforts to expand the knowledge on the coronavirus. Ms. Bracker was speaking at the PTF briefing on COVID-19 in Abuja today.
An asymptomatic patient is someone who is infected but never goes on to develop symptoms. This is different from pre-symptomatic. These are people who are infected as well but have not yet developed symptoms. During a WHO Global Press Conference last week on the 8th of June, WHO did mention that asymptomatic transmission is very rare. And we want to provide further details on that statement. We did provide it subsequently through our headquarters on the 9th and 10th of June, but it's important that also here at home that we understand what that statement meant. This statement was referring to a subset of studies and data shared by some member states on detailed cluster investigations and contact tracing activities. In those specific studies, where asymptomatic cases were followed, it was very rare to find secondary transmission. We need more data to understand better the transmission patterns. Current evidence suggests that most transmission of COVID-19 is occurring from symptomatic people to others in close contact. But please be informed that it is still unknown how much transmission is driven by people without symptoms.
As the country battles the COVID-19 pandemic, members of the National Association of Resident Doctors of Nigeria, NARD, today commenced an indefinite nationwide strike. The national president of the association, at a press conference in Abuja, described it as a painful decision following the inability of government to meet their demands. All resident doctors, medical officers below the rank of principal medical officer and house officers across all the federal and state hospitals in Nigeria are expected to join the action. And it's a tragic story in Imo State, which recorded another death resulting from COVID-19 complications. According to the chairman of the Imo State Task Force on COVID-19, a pregnant woman was receiving treatment in the isolation center and later went into labor. She delivered twins, but later died from complications. Professor Morisuwu says the babies are both negative, while urging indigents of the state to continue to comply with precautionary measures put in place by the state government. And now joining us to look at the trends in incidents and the vulnerabilities as a result of the virus, Dr. Safia Ojo, a consultant family physician, joins us from Abuja. Welcome to the program. Let's begin by asking you, how delicate are pregnant women under an epidemic, and not to mention a coronavirus pandemic?
Thank you very much. Pregnant women, we know pregnancy itself is a physiological state. It's not a disease. But we know that during pregnancy, immunity reduces. And this reduction in immunity makes pregnant women susceptible to certain diseases like viral infections, bacterial infections, and some other infections because of the immunity that is being decreased during pregnancy. Pregnant women are susceptible because, one, there is a research made when we're talking about pathophysiology of COVID-19. It's shown that COVID-19 itself causes blood clot formation in the veins, thromboembolism, which in pregnancy, we know that even pregnant women, they have a higher risk of forming clots too in their veins, which could also lead to a clot formation in the lungs from deep vein thrombosis. So the pathophysiology, they have similar features, which can make these pregnant women prone to having a severe form of COVID-19, because there is weak immunity during pregnancy and ability to respond, to well out, to handle viral infections may not be as in normal other people that are not pregnant. Although some studies have suggested that severity of COVID-19 in pregnant women is similar to other persons, male or female, that is not pregnant. But some studies have also shown that it's worse in them, and it could also affect the baby. Certain studies done in China shows that there is no in utero transmission of COVID-19 from a pregnant woman to a child, unborn child. While some other studies show that samples taken from the placenta shows the presence of the antibodies of COVID-19 in the placenta. So I think pregnancy itself, we know, is a high risk state. Because yes, it's not a disease, it's physiological, but pregnant women should take more precautions, because they should know that even while going out, they should put on their face masks and others, and make sure they ensure social distancing and hand washing and other precautions to prevent. Generally, we know there are no vaccinations that are approved for pregnant women, either for viral diseases or bacterial disease, because we don't know how safe. Even when we have COVID vaccination now, we may not be able to use it in pregnant women because a lot of studies have not been carried out to show how safe this vaccination, the vaccines, should be in the pregnant women or their unborn child. So they are at high risk. So they need to try and prevent coming in contact with this virus with these simple measures, that like social distancing, washing of hands regularly. I see a lot of pregnant women now around the hospital. They just come to the hospital, they are not even using face masks. They just go around the hospital. They are so free. So I don't know. They are not really trying to adhere to the rules.
Restrictions.
That we think
Dr.
the simple
Ojo,
rules of
I must quickly ask you if you can answer this in about 60 seconds. And that is, if you're satisfied with the case management strategy to COVID-19, and this is to handling pregnant cases. This is vis-a-vis the fact that we're having a pregnant woman who is COVID-19 positive, and her babies after being born are negative.
Thank you very much. Handling COVID-19 patients generally, what we are doing in Nigeria, apart from giving them some minerals, vitamins, we give them zinc, they give them antibiotics. And some of the antibiotics we are giving, azithromycin and others, are not even safe in pregnancy. So these are drugs that we can't give in pregnancy that is not even safe for the baby. So handling COVID-19 in pregnant women may be a big job compared to those that are not pregnant. So a lot has to be done. There are drugs you cannot give them because you don't want to cause an effect, a negative effect on the child, on the inborn child. So COVID-19, yes, supportive management, maybe giving fluids, zinc and others, but we can't totally do what we're doing for others. So they are at higher risks of having problems for COVID-19 and maybe developing complications from COVID-19. Because pregnancy itself is a hypercoagulability state, as in the risk of forming clots is higher in pregnancy, we know. And it's been shown to in COVID-19 that there are clot formation in the veins, which is similar, as I likely said before. So these are the things we need to think about, how to now try to think of better treatment of those that are pregnant.
We'd like to thank you, Dr. Sefiel Joe, consultant family physician. Thank you for joining us on the program. We have more on the COVID-19 updates when we return. As the world eases lockdown restrictions while trying to reduce the infection rate of COVID-19, we have a public health physician, Dr. Blossom Madwa-Fokwa, and she joins us via Skype from Victoria Island on the program. Thank you for joining us at this time. It's been weeks we spoke to you last. I'd like to begin by asking how you would rate our efforts at the response to COVID-19 in Nigeria.
Okay, so the last time we spoke, I believe it was at the beginning of easing of the lockdown, the first phase, and we can see that there's still a rise in the cases that we're seeing daily, and this is why we utilize platforms like yours to basically implore the public to please pay attention to the simple things. Keep your distance from other individuals. If you don't have to go out, please don't go out. And if you do have to go out, make sure you use a face covering, wash your hands regularly. So to answer your question, there's been a rise in the number of daily cases, but there's still a lot that we can do by actually imploring the public to maintain these personal hygiene practices that have been proven to stem the transmission of this disease.
So strict additional safety measures still being key, but then the NCDC DG today was saying that they're receiving testing with fake names and also fake addresses. Why would you think that, we're still seeing things like this?
Okay, so in every process, you're going to have inconsistencies. You're going to have people trying to game the system. So some of these things are to be expected, but it doesn't take away from the fact that there's a lot of progress that is being made in ensuring that the cases are kept as low as we possibly can keep them. So these things will definitely happen in any process that we embark on. But we have to just pay attention to the protocols that we've put in place to ensure that we're keeping to these protocols and that we're enforcing them as well.
How effective would the collection of plasma from those that have recovered from COVID-19 help in our studies and perhaps further treatment of patients with COVID-19?
Okay, so the idea behind collecting plasma from people that have recovered is basically to utilize the antibody. So what happens is when our bodies come in contact with pathogens like viruses, bacteria, our bodies mount an immune response in the form of antibodies. So the thinking is, if we can collect the antibodies that have been mounted against COVID-19 or the virus that causes COVID-19, we may actually be able to apply the use of these antibodies in the treatment of other individuals that have come in contact with the virus. And also in some of the vaccine trials that are going on, some of these antibodies are actually being used to study the immune response of some of the vaccines that are being administered.
All right, Dr. Blossom Mada, Fokwa, public health physician. Good to see you. Thank you for joining us on the program.
Thank you so much for having me. I appreciate it.
The Nigeria Humanitarian Fund, NHF, they've announced a $22.4 million funding allocation for 2020 that will help address the increased vulnerability of people affected by both the COVID-19 pandemic and the existing humanitarian crisis in Borno, Adamawa, and Yobe states. According to the humanitarian coordinator in Nigeria, Mr. Edward Kalon, the allocation is the fund's largest since its launch in February 2017 and comes at a critical time when the Northeast enters its 11th year of protracted crisis while grappling with the COVID-19 pandemic. Our correspondent, Blessing Tuna, joins us right now from Maiduguri, Borno State, with more on the COVID-19 fight.
The ban on interstate travel imposed by the federal government is in full effect in Borno State, but it is still baffling to see the number of people trooping into the city every day, beating the security checks from state to state until they get to Maiduguri. Now we understand that on a daily basis about 80 to 100 people make it to the city gate, and it will be a disaster to send them back at that point considering the distance they have come from. We understand there are people coming from the Federal Capital Territory, from Kaduna, from Kano, and the rest of them. Now at that point the only option with a human face will be to quarantine and get them tested before allowing them to proceed into the city to reunite with their families or send them to the isolation center, as the case may be. And that is exactly what the response team has been doing. But you may recall that over the weekend there was a clash between the Nigerian army and the Borno State COVID-19 response team, and the genesis of that clash is still about the incoming travelers.
From the explanation of the garrison commander and the apologies which we have willfully accepted, it is very obvious that there is synergy between the COVID and the security. If these people had been restricted at the interstate border, they wouldn't even have arrived at Auno, not to talk of being moved into Maiduguri. So I think there will be a fostering understanding and synergy in the operations of both the committee and the military to ensure that our different mandates are carried out to the fullest.
From Maiduguri, I am Blessing Tuna Aso for COVID-19 updates.
Egypt will reopen all its airports for scheduled international traffic on July the 1st. This after suspending regular commercial flights in March because of the coronavirus outbreak. The country's aviation minister, Mohamed Amba, says foreign tourism would be limited to resorts in 3 coastal provinces after the government said it would reopen Egypt's main seaside resorts for international flights and foreign tourists from the 1st of July. Travelers from countries with high rates of coronavirus infections based on WHO's assessments need to be tested before coming into Egypt. Here's more from the global response to the COVID-19 pandemic.
President Emmanuel Macron proclaims that France has won its first victory against coronavirus, lifting a number of coronavirus restrictions as it gears to reopen for summer unlike any other. Cafes and restaurants are reopening across the country, and travel to other European countries will be allowed. Germany, Belgium, Croatia and Switzerland are also fully reopening their borders with other EU countries. The Italian-Swiss border has also reopened, allowing people living in the border towns of Como and Chiasso to freely cross the border, which separates the two countries. A long line of cars carrying Italian cross-border commuters working in the Italian-speaking southern canton of Ticino reached Switzerland through the border of Chiasso as COVID-19 travel restrictions are eased across Europe. In Africa, Egypt says it will reopen all its airports on July the 1st after suspending regular international flights in March due to the outbreak. Flights would resume gradually and the foreign tourism would be limited to resorts in 3 coastal provinces. And in Beijing, residents are back on alert after rise in new coronavirus cases. The city reported its second consecutive day of record new numbers of COVID-19 cases, adding urgency to efforts to rein in a sudden resurgence of the virus in the Chinese capital.
Until scientists find a certified drug for COVID-19, let's all take responsibility by adhering to recommended measures to reduce the risk of being infected. That's a message from the NCDC. You can find the latest guide on their website as the centre continues to work closely with states training health workers to manage COVID-19 patients. The World Health Organization has the latest updates on the global response to the COVID-19 strategy. Their website guides the public health response at both national and subnational levels. Our website, channelstv.com, has more updates. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. That's the COVID-19 update. Thank you for watching. I'm Millicent Wonga. Stay healthy, stay safe.